Thank you for watching, and be sure to talk to your healthcare provider if you have any questions or concerns about your medications and any health conditions you may have. Disclaimer: the information presented in this video is for educational and informational purposes only. It is not intended to be a substitute for professional medical advice, diagnosis, or treatment. Always seek the advice of your physician or other qualified healthcare provider with any questions you may have regarding a medical condition. Never disregard professional medical advice or delay in seeking it because of something you hear or see in this video. Introduction: Non-depolarizing neuromuscular blocking agents, NMBAs, are a class of medications used in anesthesia and critical care settings to induce muscle relaxation during surgical procedures, mechanical ventilation, and other medical interventions. Unlike depolarizing agents, which cause a transient depolarization of the muscle membrane, non-depolarizing agents work by competitively blocking the binding of acetylcholine to nicotinic receptors, resulting in muscle paralysis. This essay delves into the mechanisms of non-depolarizing agents, highlighting key examples such as pancuronium, ditobacurarine, rocuronium, mivacurium, and vecuronium. Mechanism of action: non-depolarizing NMBAs interfere with neuromuscular transmission by binding to the nicotinic receptors on the motor end plate of skeletal muscles. These agents competitively block the binding of acetylcholine, the neurotransmitter responsible for transmitting nerve impulses to muscles. By occupying the receptor sites without initiating depolarization, non-depolarizing agents prevent the muscle from contracting, inducing relaxation and paralysis. Examples of non-depolarizing agents: several non-depolarizing agents are commonly used in clinical practice. Here are notable examples. 1. Pancuronium. Pancuronium is a long-acting non-depolarizing NMBA. It has a slower onset and prolonged duration of action, making it suitable for longer surgical procedures. Due to its autonomic effects, it can cause tachycardia and increase heart rate. 2. Ditobacurarine. Ditobacurarine is one of the earliest non-depolarizing NMBAs discovered. It has a slow onset and relatively long duration of action. Historically, it was used in anesthesia, but its use has diminished due to potential side effects and the availability of newer agents. 3. Rocuronium. Rocuronium is an intermediate-acting NMBA. It has a rapid onset and relatively shorter duration of action compared to pancuronium. Rocuronium is widely used for various surgical procedures and during intubation. 4. Mivacurium. Mivacurium is a short-acting NMBA. It has a rapid onset and a relatively short duration of action. Mivacurium is preferred in situations where a shorter period of muscle relaxation is required. 5. Vecuronium. Vecuronium is an intermediate-acting NMBA. It has a rapid onset and a moderate duration of action. Vecuronium is commonly used in surgical procedures and critical care settings. Clinical considerations: the selection of a specific non-depolarizing agent depends on factors such as the duration of the procedure, patient's medical condition, and the desired depth of muscle relaxation. Monitoring the patient's neuromuscular function is essential during NMBA administration to prevent overparalysis and ensure appropriate titration. Conclusion: non-depolarizing neuromuscular blocking agents play a vital role in modern anesthesia and critical care. By competitively blocking acetylcholine receptors at the neuromuscular junction, these agents induce muscle relaxation and paralysis, facilitating surgical procedures and mechanical ventilation. Pancuronium, ditobacurarine, rocuronium, mivacurium, and vecuronium are examples of non-depolarizing agents, each with specific characteristics suited for various clinical scenarios. Understanding the mechanisms and distinctions of these agents is crucial for healthcare professionals to ensure safe and effective patient care.